coming up to 12 minutes past 8 now. And as we've been hearing this morning, some schools in Northern Ireland are back today. There are just over 2 weeks before pupils go back over here, well and truly signalling the end of summer. And as we move into autumn, it's typically a time when cold and flu starts to fly around. And in the continuing global health pandemic, the Department of Health is keen for us not to ignore potential coronavirus symptoms. And we're joined live in the studio this morning by Minister David Ashford. Really, the message, Minister, is don't be complacent.
It most certainly is, Beth. I think obviously there's always a risk, particularly when the island's been without cases for so long, that people will now dismiss symptoms and think, oh, it's something else, it's just the usual seasonal flu. It's important people don't do that and they do present for testing, because we need to ensure that we keep the island as safe as we possibly can.
It is likely then there will be an increase in demand for the 111 line as the cold season progresses. What contingencies in place for that?
So we've been working up. The staffing rota around 111 is remaining the same. We've also built in microbiological capacity as well within our labs so that we can process higher numbers of tests.
A flu vaccination programme is planned for school children around the Isle of Man. Many parents received their consent letters in the past few weeks. What's been the general response to that?
So we've had a very good response, not just amongst the children's aspect, but also the adults aspect as well, because we wrote out to all those in the vulnerable category, suggesting they might want the jabs as well, and it's been a very high take-up so far.
And have we got enough vaccine for everybody who might want it?
I know they've had people in touch with me concerned about that, but at the moment there is no shortages of supplies, and we are able to vaccinate those who've requested it.
And will this flu programme be rolled out amongst the secondary schools as well?
So at the moment it's just looking at certain categories of people and obviously the younger children, but we will be probably looking to roll it out amongst the high school children as well, should we have the capacity to do so.
There's an interesting story on the front of the newspapers this morning suggesting it's teachers who are more likely to pass it on. So are key workers like that going to be offered the vaccine?
At the moment, again, it would only be depend if they were in the vulnerable category. Obviously, anyone can go to their doctor and ask for the flu vaccine, but we're focusing on the most vulnerable.
Interesting thought when we come to pupils going back to school. If one of them, for example, a pupil has a cold symptoms, something like a sore throat, are they going to be asked to stay at home, or will we have a little bit of tolerance for what are considered to be normal simple illnesses?
So it depends upon the symptoms they present. If the symptoms are similar to COVID-19, such as a fever, etc., then they'd be asked to stay at home until the test is done and they get the test back negative.
And looking at the general picture, Minister, people still may be expecting a further easing of border restrictions, given the fact that we haven't had any cases for what it will be 95 days today, I think. What's the situation there? What can you tell us?
So at the moment, border restrictions remain the same. They are reviewed every 2 weeks. We are continuing to do that. But at the moment, we're not ready to move to level 3 just yet.
And how prepared are we for any more cases?
So we are prepared. The track and trace team is still in place. We also, as we say, have the 111 line, and we also have ramped up our testing facilities as well, so we can test more people if necessary. But it's important that people aren't complacent, and anyone who does feel unwell does present.
And we know that the border patrol is now up and running. That was announced by government last week, and it's at full capacity. So can you guarantee that everybody coming back to the island will be checked upon to make sure that they are self-isolating as they should be?
Yeah, we have been doing randomised checks earlier, but we will now be checking every individual. They will at least have a phone call.
Wonderful. Minister, thank you very much for joining us this morning.